Hey everybody, it's Dr. Kevin McGovern, and today is episode, wait for it, 12 of the Velocity RX podcast. And I not only have one, but two special guests. I actually found two people willing to come on the show, which is amazing. I have Nick Lemke, who is a registered dietitian who's going to talk to us about sports nutrition. Certainly not getting nutrition help from me. And a returning guest, Dr. Clay Hammonds, a physical therapist all the way from Georgia. We're able to do that now with this internet hookup. So he's also a physical therapist who specializes in baseball injuries. So, gentlemen, welcome to the show, and thank you for coming on.
Oh man, thanks for having me on, Kevin.
Yeah, thank
Appreciate
So,
you.
it.
so Nick, we'll start with you because you're furthest away. You're like way across the country. So why don't you tell us who you are, what you do, and what you specialize in?
Yeah, so I'm Nick Lemke. I am a performance dietitian. I really specialize with teen athletes, helping them get bigger, stronger, faster, helping them really get to that next level in the best way possible. Because as we know, high schoolers have no idea how to eat, and they won't listen to parents. And so I'm that bridge in between to help athletes know what they need to do so that they can eat to perform at those D1, D2 pro levels, etc.
Cool. Clay, tell us about you.
Yeah, so
Besides
physical
wearing that
therapist.
very ugly hat, but
No, man, this is the team,
there's
man.
no apparently no dress
World
code on the
Series,
show.
man. We are, in shambles. Speaking of injuries, right now, the Braves. So just hoping that we can bounce back. But yeah, so physical therapist, been a physical therapist for 10 years. Like to specialize in baseball injury prevention and then treating injuries that may occur that maybe should not occur and figuring out why they occurred.
Awesome. So, gentlemen, we know that I never thought growing up playing baseball that I would say that baseball by far has more injuries than basketball, football, soccer, hockey. It's insane how many injuries there are, and we can probably spend hours pulling apart the why. But focusing on kind of where our niche is, these adolescents, which the last study I saw, I think it was 67% of all Tommy John injuries are in the 12 to 17 age bracket, which is alarming. It certainly wasn't when I was growing up, but the opportunity to play many games has gone through the roof with travel ball, which wasn't around when I grew up in the mid to late 80s, and now it is. These pitchers are playing on three teams and they're throwing God knows how many innings a week, and it's not being controlled, and the strength and conditioning they're getting is suspect, and these arm injuries are happening. So, Nick, starting with you, what are you seeing as far like when you have an an athlete who is injured, whether it's a pitcher or anyone else, is nutrition change for you?
Oh yeah. So when it comes to nutrition for recovery, we really and for a season in general, so the way that we eat in season should not look the same as what we eat in the off season. What we eat in season when we're performing, we need to take it to another level. Like when we look at LeBron, for example, he amps up his carbohydrate intake during the season, especially during the playoffs, because he knows he's going to be in a more intense situation. And that's not carbs as in sugar and chips and things like that. This is like complex carbs. Yes, he's getting like fruit, vegetables, things like that in there. But really that carb intake amps up the fish piece. So omega 3s are really big for recovery, whether it be muscles, brain, etc. And so ideally getting that from food like salmon, sardines, things like that. Um, Also hydration. Like a lot of these guys are not drinking enough water. And when we think about waters in our blood, it's in our joints, it's in our muscles, it's in our brain, it's in everywhere. And if we're not getting enough water, getting blood, we're not getting enough blood flow to those joints, to those muscles for recovery. And so that's a big deal as well. And then just color. So I'm not one to be like, oh, eat your fruits and vegetables. I'm just like, hey, eat color, like eat more color 5 to 6 times a day. Get some berries in there, grapes in there, greens, things like that that are going to have more of those recovery nutrients. to really help you bounce back faster from injury. The way that I like to talk about it though is, I mean, you guys know there's inflammation in those joints. There's inflammation, there's stress when there's an injury, and really in general. And so, what all these foods I'm talking about, the antioxidants, the omega 3s, they help reduce that inflammation so that we can recover faster. And then also during those time periods, foods that I would tend to avoid is going to be lots of the Chick-fil-A, Chick-fil-A sandwiches, McDonald's, pizza, a lot of those really heavy fried foods. Those are the times that we really want to be intentional. Doesn't mean we don't ever eat them, but we want to make sure that when we're in that recovery process, we want to try to minimize that as much as possible.
All right, cool. So
Yeah.
Clay, all
Yo.
physical therapists are not the same. I don't mean that to be disparaging to someone else. I don't know a thing about spinal cord injuries, right? I don't know a thing about chest PT, nor would I ever, but I do know a fair amount of orthopedics and sports medicine, as do you. When your child is injured, what should someone look for a, and besides insurance, my God, right? If you're calling up whether your HMO takes your insurance, you're already going down the wrong path. You're already going to get the cookie cutter approach, and your kid is never going to get better. If he gets better, it's roulette, meaning you hit 20 on the roulette wheel. Okay. So putting assurance aside, what should parents be looking for in choosing the right person in their area if it's not in your area or my area to get better?
Yeah, I think in today's world, it's very wide open in terms of the internet too, right? Like you don't simply have to go to your hometown to get good sound advice, right?
Right.
And so, but I think that you need to look at what is injured on your child, right? So is it a leg? Are they a what do they do? Do they pitch? Do they just bat? Do they play shortstop, right? What's going on? And then finding someone who's in that niche that really understands the mechanics, because to me, they all there's always a why to the injury,
Mm-hmm.
right? And so it's figuring out that why. And typically it's something mechanically that we're not doing correctly, right? Or that you've been taught incorrectly and you've kept doing it. That's led to the injury. So, like you said, yeah, if I want to go through my insurance and I go see my doctor, and then I go see my ortho, and then I go get my MRI, and then they send me a referral to therapy, and I go to the local therapy joint, the mill, that there's 5 therapists working, and they're seeing 3 patients at a time, and you see the therapist for 10 minutes, and then you go work with the tech for 45 minutes on the same exercises that the other 2 people are doing. And like you said, could you get better? Yes, the chances are slim. Could you get better a lot faster if you saw an expert in that field, who's going to get down to the root cause of your problem biomechanically? I think that's what people need to be looking to do.
1000%.
I have to input. It's very similar to with dietitians. Do you go and see a dietitian at an outpatient clinic that deals with morbidly obese people to address your high school athletes' nutrition to build muscle? Like it's a very, I mean, just as a contrast or as a
Yeah, I never
comparison
thought
with
of
you
that either.
guys. Yeah.
All right, Nick, we're going to have to talk about this. I got a teenager. If I said the F word, meaning fish, she'd have a heart attack. So, how does someone who doesn't like seafood, or like fish, get the omega? Like, is that now through a supplement? Is that through vitamins? How does that work? If someone, I mean, teenagers are finicky when it comes to food, right? So, whether it's fruit or vegetables they don't like, or it's fish, how do you get past that, and how do you make up for that deficiency?
So first off, I gotta say mind over matter. So if you really want something bad enough, it's that discipline. And when it comes to eating in general, we can overcome a lot of those things. It's that we're so used to eating a certain way. It's like peanut butter, for example. I'm at my sister's house right now, and she has Jif. And I'm used to eating like the freshly ground peanut butter straight from the store. And I eat that Jif, and I'm like, that's disgusting. But for most people, they're used to that, and that's what their taste buds are accustomed to. So
Gotcha.
I
That's a
think
good
I
point.
think part of it is that slow introduction of it, like, you know, fish tacos or things where you can get better, you can enjoy some of those fish, find the fish that work for them, get some exposure to it. Um, and then, you know, over time they'll get used to it. I mean, with anything, we can get used to a lot of tastes. Now there are genetics that some things are out of our control, you know, certain things cause people to throw up, etc. And so in those cases, I would say, you know, looking at omega-3 supplements that especially have the DHA. The DHA is the one where we have the most research for brain and for recovery. And then with any supplements, I actually was just building out a supplement landing page for my website for a supplement safety guide. And one of the big things I really stress is making sure they're third party tested. And so if it's just a general supplement, anybody in the population, USP is a good certification. But for athletes, we really need to push NSF certified for sport or Informed Sport certified to make sure that they don't have any NCAA banned substances, things like that in them. Granted, with an omega-3, we're a little bit safer than if we do like a mass gainer, protein, creatine, etc. for the third party testing, but I still recommend it. And so, yeah.
And then one other follow-up. What is a complex carbohydrate?
Mm.
Give me
Complex
a
is,
couple of
yeah.
examples of that.
Yeah. So complex carbs, basically the carbs that are going to digest slower in the stomach, and they kind of take longer to go down, which means they also tend to get to the bloodstream slower. So, you know, we're not going to go and eat beans as our carb right before we go for a run. Like beans are slow digesting. It takes a while for that to kind of process. Versus if we're having, you know, banana, orange, watermelon, things like that that have more of those simple carbohydrates, those quick sugars to give us that quick energy right before a workout.
Gotcha. So, Clay, what are the basic, you know, an injured pitcher comes in, you know, let's just say we'll just pick, you know, Little League elbow.
Okay.
You know, what are the root causes that you have seen that cause Little League elbow?
So the athletes that I've seen with Little League elbow, I can tell you that 90%, if not 100% of them, if it's they're not able to balance on their backside, right, or load into their back leg and hold it long enough, and they get on their front side way too quick, right, and then so everything's here, right, and then you just it's all arm, right,
Mm-hmm.
so they're just not using their bodies, and I always treat it from the ground up, right. Let me see you squat, let me see you stand on one leg. How long can you stand on one leg, right? Do you have the stability in your legs and in your core for your arm to operate functionally? And most 11, 12, 13-year olds don't.
No.
I mean,
Or
they just,
or some 15, 16, and, you know, college players don't either, right?
right.
But
But
they're in the weight room throwing 330 pounds on their squat, right, or their deadlift, but can't stand
right.
on one leg.
Yeah. And so, I always have that approach. And I think that's, going back to your first question, what's the difference between somebody like you, Kevin, and the mill physical therapist that just got out of PT school, that just passed their boards like 2 months ago, is they're going to go to that person and they're going to treat their elbow with ultrasound or,
Dry
maybe
needling.
maybe they do some dry needling, right? Which is fine, but you're just treating the symptom, right? Like, oh, I'm going to help these symptoms. And maybe in 4 weeks you feel better. And then you're going to go back and do the same damn thing that got you in trouble in the first place when you haven't really assessed anything biomechanically, especially for the lower half, because you're thinking elbow, you know, and you're not thinking what's going on in the legs, what's going on in the core, what's going on in the spine, where's your
1000%.
where's your shoulder blade, what's your scapulohumeral rhythm, right? Most PTs, as you said, all PTs are not created equal. Most PTs, when you go to those places, are not going to look at those things.
No
So
chance.
you better find somebody that knows mechanics of throwing and what it takes.
So the next topic's a little controversial. So since I have started my Velocity RX online course, I have spoken to, I don't know, 50, 60 parents. And that's enough sample size to say that the parents have a huge part in their child's injury. Okay. Huge. Either they went after the shiny nickel, they don't know enough to listen to the right person to get help. And I have the classic example. So 10:30 at night on Friday, my phone starts blowing up, like through the Instagram, through this guy's asking me all these questions. My son's got little league elbow. I need to come see you. Got diagnosed in February, went to PT, still can't straighten his elbow. So I asked 2 questions and haven't heard from the guy since. When did you allow him to throw again? Okay, because I don't care what it is. And from February to July, if your elbow isn't straight, it's because there's something preventing it in there from being straight. Oh, I asked if, he had the MRI, had everything, nothing. Yeah. So that was that. And I said, you realize that Little League elbow is a Tommy John injury, just the growth plate, ripped instead of the ligament. Ghost. So right then and there, I know that the person coaching that child is the father, and that father is directly 100% responsible for that injury because the father let him back on the field to, oh, it's the big game. Maybe my kid can pitch, because the things just didn't add up because I kept asking questions like, well, that doesn't really make sense. Yeah, of course, PT can't straighten his elbow, this, that, and the other thing. So, Nick, we'll go to you. Do you see parents blocking or not being advocates or something that would prevent you from doing everything that you need to do as an expert, because you are an expert in your field, to get their kid where they need to be?
Yeah, I would say those are typically the people that don't work with me. Like, to be frank, like the
Yeah.
ones who are willing to work with me are the ones who recognize that they're at their end. Like they can do what they can, but if their athlete doesn't listen to them, or if they don't know what they don't know, a lot of them recognize, hey, we're not experts in sports nutrition. We don't even eat well ourselves. So this is where we come to you to help, address their needs. Um, I do see it a lot where they're not willing. I mean, I've even had conversations where I've had coaches, and this is a problem with really all areas. I feel like we should be more collaborative like this, but I see a lot of coaches who are quote unquote experts in nutrition. I see others who are quote unquote experts in mental performance, and that's not their thing. And so that's where it's like that's the same thing as, it's not just the parents but also even a lot of the coaches who won't even allow me to come talk because they're like, oh well, we have a team doctor, a doctor that got 40 hours of 40 hours total of nutrition
I love it.
unrelated to
Now,
sport.
just for the record, I'm assuming you're not asking for a $500 speaker fee. You're coming for free, and they're still telling you no. I
Yeah,
love that. Like that's just like, here's knowledge. No, we're good. I see
yeah.
it all the time. I did it down here locally. Like, I want to come talk to you about throwing mechanics, injury prevention. Oh, we have a physical therapist on our board. Does he specialize in pitching injuries? Well, no. Oh, okay. Okay. Just checking.
Yeah, there's even a local college, like university, private university, that they went to work with a hospital dietitian because they have a partnership with the hospital over having me, collaborate with them essentially. So yeah.
So, Clay, what do you see either from the parent or more or worse, the parent coach
Mhm.
interfering in the, rehab or they think they know everything kind of area. How have you seen that? How does that affect you, what you do?
Yeah, I've seen it on both ends. I've definitely seen it from the parents in terms of, oh, I love to see little Johnny pitch, and I really just love to see him play. Well, that's all fine, but if he's hurt, don't throw him out there, right? And so I have seen some parents just keep pushing and pushing and pushing to play and play and play, and maybe they come and see me for a visit or two and think they're better, and they will get better eventually, but it takes time, right? But they don't want to put the work in. They want the quick fix. Everybody wants the quick fix, and that's what I see, and that's where we are in America, really. Like, we just want the quick fix. And in terms of pitching, it's just it's just not. I mean, it
No,
takes it
could be a
takes
six, could be a
time.
6 month fix, could be a year
Yeah,
fix to build different
and
mechanics.
so from the parents aspect, I think sometimes, and they're paying a lot of money for little Johnny to play ball, right? I mean, they're, $3,000, $4,000 a year for him to, be on this travel team and then play school ball and, do all these things. So, like, I get it from the investment standpoint, but don't do it to the detriment of your child. And
Love it.
get him or her the help that they need, and fix it instead of trying to find the quick fix. One visit of treating symptoms isn't going to do it.
Nope. Nope.
And then conversely, I see it on the coach's side too, where I think it's an ego thing. Like, sometimes, like, oh, I'm a baseball coach, right? Like, I need you to treat the problem, but I'm gonna coach on baseball, and that's fine. But if you're sending him to me to fix the problem, and I start doing a biomechanical analysis of the way that he pitches, and I find things that are just glaring right away, like, oh, no wonder you have elbow problems. I'm going to try to fix those, right?
As you should.
Yeah, and so I've seen some, um, where that's become a rift before, and I think it's an ego thing, where it's like, hey, he's not hurting because of what I'm teaching. Couldn't be, right? Well, maybe it is, and
Just
this
maybe.
and this is really what you need to be doing. And so I've had that happen where, I've made an offer, and, a family accepted the offer, and then they go back to the coach and I never hear from them again. And
Crazy.
so, and
But it
yeah, and
happens. It happens. It's constantly. It constantly happens.
it's just frustrating because it's like, man, I know I can help this kid,
Hmm.
like, give me, you know, 2 months,
Right.
and you're gonna be just fine. But sometimes the coaches won't allow the parents to help their kids because they think that they know more.
More than you.
So, yeah.
So Nick, if you had to, I don't know, you had 10 minutes on an elevator or 15 minutes, you got stuck maybe on the 7th floor, and you had like 4 or 5 tidbits of your best tidbits of knowledge to give to let's say you're trapped in the elevator with a baseball pitcher and his dad, and you got, what are your 4 to 6 go-to things that they have to do to be successful with the help of nutrition?
Mm. So number one, I
And
mean,
Clay and I will call the police. We'll get you down after you do this. We'll get you out of the elevator.
so number one, I mean, everyone talks about protein, and the way that I approach protein is get a solid source of protein at every meal. I mean, we do need that to build muscle and whatnot. However, a lot of us are overdoing the protein. A lot of these athletes are way overdoing the protein with all the like 3 protein shakes a day on top of eating meat at every meal. And it's like, that's way too excessive. So, and that's where we can't really build muscle because we're not getting enough energy. And so that's where I'm like, okay, getting carbs at every meal. If they're trying to build muscle, definitely more beneficial. If they're trying to lean out, there's a little bit of conversation. Side note, we'll talk about there. But especially carbs, even around the workouts. This is something breakfast, pre and post workout. Those are my big three that I change right off the bat when I work with athletes. And that makes the biggest difference: more energy, more muscle, all of that within a short amount of time. And so that's where we get the protein, the carbs. And then for pitchers, hydration, like y'all are drenched. You guys are sweating a lot, but also again, getting that movement. It's just like, we talk about how cardio can be good, endurance can be good for some of that shoulder recovery. It's like kind of similar where you're getting blood flow, you're getting movement by keeping yourself hydrated. And so that would be a big one. Eating some sort of color. If there's a huge issue with vegetables, again, it's things we can work through. Smoothies, there's a lot of different ways we can do that, but at least trying to get fruit in there regularly, trying to get different colors, because different colors provide different benefits for the body, for that recovery process. And then the last one is food first, or supplements. You can't out supplement a bad diet.
Ooh, I like that.
So yeah, so that's a line that I like to use a lot. And it's, yes, supplements can be beneficial, and for the athlete may need them in some cases. Like creatine, for example, I do like using that with my athletes, as long as parents approve. I'm very clear about that one. But if you're taking all these protein shakes, and number one, they're not third party tested, but number two, you're not getting enough calories. It doesn't matter if you're taking all this protein and you're not eating enough. And when we talk to MLB dietitians, I listen to webinars regularly from them, and they talk about one of the most common things that athletes lack at that level, minor league, major league. It's actually carbs, not protein. So yeah, because everyone's obsessed about protein the last 5 to 10 years,
Right.
which understandable. We were overdoing carbs for a while there, but now it's like now we're underutilizing carbs, especially for athletes. So yeah.
Great. All right, we'll let you out of the elevator. All right, Clay, we're slamming you in the elevator. Give
There we go.
give your top things that a pitcher, exercise tidbits, your tidbits of knowledge, even though you're wearing that ugly hat.
Oh man, it's the best hat in the world.
Go
Yeah.
Mariners.
Jim
So,
Leyritz. Go ahead. What?
man, the Mariners are making a lot of moves right now.
They are making a lot of
Hoping my
moves.
Well,
Braves
they
get
need
a.
to.
I'm hoping my Braves go out and get Garrett Crochet today. So we'll see. Top exercises for baseball players, pitchers. Man, I mean, everybody's working cuff, right? Cuff's fine. Do your bands, all that stuff. I would say really focus on your lower half, stability on your drive leg, and then stability on your plant leg. I want to see stability of lower half and core. Baseball pitching is a rotational movement. And so I like a lot of rotational stuff. Med ball throws against the wall, rotational overhead med ball throws, because it is a very powerful and forceful thing that you're doing. So training that way is really key. And then in terms of the cuff, I would say deceleration is the most important part. So I like to train my posterior cuff decelerators a lot because you can't speed up, but you can't slow down. So
Love it.
uh, that's what I have a very simple ground up approach. Like, okay, let me examine your squat. Let me examine your balance. Can you jump on this leg and then land on that leg and hold it? No, you can't. Well, then you really can't pitch then, right?
Exactly.
So big on legs, strengthening, explosiveness, balance, and then deceleration for the rotator cuff. Those are my big things that I like to train in pitchers.
I love it. So as the fireman who rescued you two out of the elevator, I'll add my 2 cents in. And that for me, it's even simpler. You really, in any athlete, because I believe that these two movements are right off what I call the fuse box, which is essentially, our spinal cord, right? We look at embryo, we have a head and a spinal cord, and these guys grow in after. And any athlete, especially the baseball pitcher, has to master scapular depression, and they have to master the squat. Okay, to me, pitching is squat, squat, lunge, rotation, squat. Okay, so just like Clay said, how do you get stability? Well, it starts with your lumbopelvic juncture, your groin, your glutes, your hamstrings. That is, and there's no better exercise on the planet. But however, beware, the squat is the most poorly performed, poorly taught, poorly whatever. You'll say, "Oh, I saw muscle and fitness." No. So two key things of the squat: your knees never go forward over your toes, and you must maintain your lumbar lordosis throughout the entire movement. If you lose it, you just shut off your entire posterior kinetic chain. And then stop shrugging. those are my tidbits. All right. So Nick, how do people find you? Because you're like west of the Mississippi. So how do they find you? What do they, you work remotely. So that's great, right? It's not just in rainy Seattle where you're at
Yeah.
now. So tell us how they get a hold of you. Excuse me.
Yeah, so I work with athletes all across the US, so that's not an issue. Power of Zoom, power of online. Easy way to find me though, Nick Lemke RD on all platforms. So Nick Lemke, Lemke, and an RD. That's on Facebook, Instagram, Twitter. I did lay off of TikTok, not on there so much anymore, and then YouTube as well. So
Outstanding. Dr. Hammonds, how do we get a hold of you?
Yeah, so the greater Atlanta area, I guess you would say, Gainesville, Georgia, about 15 minutes northeast of Atlanta. Currently looking for some brick and mortar space, just transitioned from a corporate PT world job, insurance space into cash space. So getting all my social media and all that stuff set up now, but at Clay Ham, ClayHamm on Instagram, or Clay Hammonds on Facebook. Just shoot me a DM. Be happy to talk to you.
Fantastic. You guys can always get a hold of me at velocityrx.org. And that's got all my links to my social media. But gentlemen, thank you very much. And we were definitely, Clay, this is your second show, but Nick, I kind of like this. I think it's having the nutrition part of it. I mean, I learned stuff today that I didn't know. I
Yes.
think is vital because especially with nutrition, I see a lot of people, go into GNC and grab the shiny nickel, just like Clay and I see stuff on TikTok or whatever. They're going after the shiny nickel of, let's throw a weighted ball, it's 10 pounds against the wall because we saw it on social media and it just doesn't work out that way. So, but thank you, gentlemen, both. And please, everyone, please like and subscribe this podcast. You can find it on Apple, you can find it on YouTube, and we'll see you at the next show. Thank you all for participating.
yeah, thank you.
Thanks, guys. Thanks, Kevin. Thanks,
You're
Nick.
welcome.